So good morning everyone. My name is Dr. Ojus BHANOT and we have designed an innovation called Sterilux, which is a simple sterilization method for the AT prism and gonioscope. So let's imagine this. A patient comes to the OPD and has some ocular surface disease, and in that this contact procedure of AT and gonio is done. So all these viruses, fungi are transferred to the AT gonio prism and lenses. This calls for a need for disinfection to minimize the cross contamination between patients, improve patient safety and care, and reduce healthcare associated infections. Uh, so, the problem statement that we worked on was that AT and gonio both are contact procedures, but the disinfection is cumbersome. Even though when it's done, it leads to improper disinfection and risk hospital acquired infections. So this is a small video of how it's done in our OPD. So first, hypochlorite is put in a petri dish. The prism is taken and washed in RO water and then wiped with a sterile gauze. Then this prism is put in the hypochlorite solution for 3 minutes, washed again and wiped again. So all in all, this is a 6-step procedure done by a sister, which itself is time consuming, is difficult in a busy OPD, and is labor intensive. So then we thought, what's the solution? And we developed a solution called Sterilux. Now let's go back again to the same patient who comes with the ocular surface disease. The microbes are again transferred to the prism and the gonioscope, but this time what we do is we place it in the Sterilux. So Sterilux is a box which has a docking area for both the prism and gonioscope, and inside it's lined with the aluminum foil for reflection. In the center it has got a UV bulb. So when we place the lens and the prism, this is the docking area specifically designed with respect to the size of both. Now the doctor can close it, and as you can see, as it closes, the red light goes on. It provides a 10-second holding time only, indicated by the red light, after which the 10 seconds are over, the red light turns to green light. So the doctor knows the sterilization is over, and he can go ahead, open it, which is safe because the UV light is off now, and remove the prism and the gonioscope and safely use it for the next patient. So the core concept of using UVC over here is that UVC kills bacteria, fungi, spores, viruses. It is also effective through the tear debris because that's a clear film. It's effective in medical equipment sterilization, surfaces, air and water sterilization, as it's widely already used, and is safe and skin friendly. Now the UV dosage was calculated for anthrax spores, that is 1000 joule per meter square. So this is the most deadly virus. We took the maximum what it needs to be the target dose. Then we used a 3-watt bulb, which gives a 254 nanometer wavelength of UVC. Irradiance at a distance of 5 meter was calculated, and the UV dose can be this formula UV dose is equal to irradiance into time can be calculated to get the time. Now surprisingly, for 90% disinfection, that is 1 log raised to power 10, you need only 0.83 seconds of holding time. But we took it further. We took for 99.9999%, that is 6 log raised to power 10, that is the sterilization level. We needed only 4.98 seconds of holding time, that is 5 seconds. We took 10 seconds just for a precautionary sake. Now the best part is the cost. The most expensive out of these is the microcontroller, 200 rupees. Next is the 3-watt UV bulb, 165 rupees, lasting for 6000 hours, about more than a year, 2 years maybe. And though the total cost comes out to be only 550 rupees. That is what it costed us to make that box. Now the strength is, it's efficient, it's user friendly because the doctor himself can do it. Time saving, he does not need to call a paramedical for it. Streamlines the sterilization, 6 steps are reduced into only 1 or 2 steps. And it's safe because UVC is also used for water sterilization, food sterilization. So definitely it's safe when there's no direct exposure to skin. A few limitations also need mentioning, that it's ineffective for physical decontamination right now. So what you can do is just wipe it and keep it, quickly wipe it and keep it. So that will take care of the physical decontamination. Right now the battery needs replacing, but that can be easily overcome in the future models using an AC source. Thank you. That's my little presentation.
Yeah, I think it's a very good innovation.
Thank
because the only thing is the procedure which you earlier adopted in your institute
you. Yes, sir.
was very cumbersome,
Mm-hmm.
and that is why you needed to replace it. Because wash with the easier way which we have found practical is just do a split swipe, keep it and use it. So
Mm-hmm.
just आपने वो aplanation किया, split से swap किया, रख दिया. So that's very easy. But this is very good, innovative.
So we actually, when we were in the process of developing this, we also thought that should we use alcohol.
Yeah.
Alcohol is known to damage the film, anti-reflective, so scratches वगैरह come sometimes.
So like we are using our equipment for more than a decade now,
Okay, sir.
right?
Uh-huh.
And earlier, you see, I'm also SN trained, so we used to wash every time, and that I can tell you, washing and then drying it
Yes,
out
sir.
was really painful.
Yes, sir. Yes, sir.
And one fine morning, I thought, कि let's stop washing, and just sprit से mop करके उसको dry sprit से करके रख देते. Even for that lenses which we are using for laser purposes,
Okay, sir.
we are using the same tick, no water, nothing else. And not even that usual alcohol, but we will just take the same spirit.
Mm-hmm. Yes, sir.
Especially our confidence level increased after that COVID experience, where everything was spirit based,
Yes,
right?
sir.
So that's my take on this, but it's very good idea.
Thank you, sir.